here. Thank you. Yes, please. Yes, please. Thank you. Good afternoon, team. Now that we have our technological challenges sorted out, we'll just wait for our participants to come in. I'll also start our Facebook Live because we're going to be well and truly famous today. So if I can just get one of our participants to either pop a question in the Q&A just to say that you can hear and see us and you can see our shared screen. Thanks, Rose, for raising your hand. Participants can see our screen. Let's have a look. Excellent. Howdy, howdy, excellent. Thank you so much, team, for letting us know. Give us 1 second and we'll start our Facebook and we're good to go. Lucky we know about vaccinations. Hey, Jamie.
It's certainly not my IT, is certainly not my forte.
Okay, we are live. Put us in the screen there as well. Jamen, look at you. Smile for the camera. Awesome. Well done. Thank you so much, team, for joining us on what is probably, I'm not going to lie, I'm very nervous about this webinar. This topic, it does not come naturally to me. So I'm so glad that you are here to help us through this, because this COVID vaccination thing has become an absolute minefield.
Absolutely, yeah, and you're not alone. I don't think it hasn't really been hasn't really been cemented down and placed everything, and we don't actually know every single thing that's going to happen and how it's all going to sort of pan out. But we are starting to get some indications from some court cases and obviously some government directors that are giving us some ideas about what we need to do and how we need to do it.
Yeah. All right. Well, first things first, Jamen, give us a bit of an introduction about you, because I'm sure our participants know who I am. They see my face often enough. But it was a year ago we were here doing a webinar about mental health.
Oh, was it that long ago?
It was that long ago.
Wow.
Yeah, had I known, because the dates were on the slides that I looked at. So tell us a little bit about you.
So yeah, Djambul is a consultancy firm. We do mostly work health and safety, but we also do a bit of project management when we help with communities and training and mentoring and all that sort of stuff, community engagement, I should say, mentoring and all that sort of stuff. Yeah. Initially, COVID was fairly slow for us because everything closed down, and I do work all across Australia and through the Cape York and Torres Straits, which meant we weren't allowed to really travel up there. But as soon as it all sort of started to kick off, then we were lucky enough to get some projects in regards to setting up the testing clinics. And we did all the vaccination clinics, and we did a big heap of things from a project management point of view. And we started working with a lot of the hotels and hospitals and healthcare centres to develop COVID policies and all the processes around that. So we had to sort of get up to speed very, very quickly, which meant that was really good because we were very, very busy getting everyone up and running and ready to go. But yeah, no, it's been really great.
Right, so essentially you don't need me, you'll be right.
No.
You've got all of this, you're good to go.
I'm still only doing it from a safety point of view, so I think where I am is probably a little bit further than where the legislation has caught up to. But yeah, again, we'll talk about being risk averse and doing risk management, which is really what I was focusing on from a health perspective. But now we're sort of getting into the HR legal side of things, which is a little bit more tricky.
Yeah.
So, and again, hospitals obviously have been dealing with COVID for quite some time and working full capacity. Dealing with it, so we needed to have everything in place for them, but it's a fairly strict work environment within hospitals, so it's quite easy. Yeah. And there's still obviously issues from a HR point of view, because there's still a lot of nurses, doctors, medical professionals that didn't want to take the vaccine or had issues in taking the vaccine, so we needed to work around that and deal with that as well. So even that environment is still difficult.
Absolutely. And I think that probably brings us to our our slide here, which hopefully technology is going to work well for me. First things first, the rules are not clear. Essentially, we are all doing the best that we can with the information that we have, and we're literally taking bits from here, bits from there, and trying to push it all together and come up with solutions. So we're taking whatever we can from wherever we can. We're taking precedents that's been set by Fair Work. We're taking information from Workplace Health and Safety. We're taking direction from the likes of Queensland Health and all of these other employers or workplaces that have mandated vaccines. And we're trying to do the best that we can. No doubt it's going to be challenged at some point, and there is going to be pushback. But first and foremost, this webinar is not a social debate. We're not talking about pro-vaccine, anti-vax, or anything like that. We are purely talking about the requirements for an employer or a workplace in determining if vaccines are a reasonable requirement for your workplace. Okay, so it doesn't matter whether you are pro-vaccine, anti-vax, or whatever. That's essentially not the topic of our conversation today.
Yep.
Yep. And the other disclaimer is it takes me back to the beginning of COVID. We were talking about JobKeeper and all of those sorts of things. What we say today is not guaranteed tomorrow, essentially, because there is so much happening in such a short period of time. So it's really important that you do keep up to date as best you can, using all of your resources to try and keep your finger on the pulse as we navigate through.
Or just wait for her to do all the research for you because she's really good at it.
Jamen, that's why I brought him in today. Exactly. No, Phoebe's not here. She's like, no, this one's way out. So we'll leave that one to Deanne and Jamen. So let's talk about Queensland and where we're at, because essentially we're a bit behind the eight ball.
Yeah. So because we've and sort of like WA as well, because they've had very low COVID sort of numbers, no one's really had to deal with it directly that much. So we haven't had to get a lot of the things in place, and a lot of people haven't. So there are some things that have come out, obviously. So we've got the directives from the federal government, from state government, in regards to international travel and state travel, but then also all the medical facilities, aged care facilities, quarantine facilities, that are all sort of obviously have already got mandates in place. So we know them, and they're all pretty straightforward. But again, as I said before, there are still difficulties in trying to put that in place and how that actually affects everybody in the workplace.
Yeah. So Western Australia, I saw overnight an update that they've essentially mandated vaccinations for 75% of the working population. And it's interesting that as a state, they've had relatively low exposure or low numbers of cases, but they seem to be the strongest when it comes to mandating vaccination.
Yeah, and then also, I mean, I think they're about midway in vaccination rates as well. So again, Queensland, I think, is nearly last in vaccination rates. So that's going to be a big issue for us moving forward when they start opening the borders, which it seems as though they're going to, which will then obviously those people, it's going to make it harder to manage staff in that situation. See how we go.
And because, in the background, we've got this whole other elephant in the room, I guess, which is the employer's responsibility in terms of mitigating or minimising the risks associated with contracting COVID in the workplace. So yes, this is a big part of it, what protection measures employers are putting into place, but it's also then the minefield of, okay, well, how do we navigate that?
No, that's what I mean. So that's why it's going to make it harder for employers to manage that, because they are going to have to go through that, because there's a good chance that they're going to have more workers that aren't vaccinated to have to work out how you're going to work around that if they either don't want to or can't, or haven't had enough time to get the double dose on time.
Yeah. Do you think that WorkCover could, and again, this is crystal ball stuff, adopt a philosophy that the workplace should have mandated vaccinations, and because they didn't mandate the vaccination, that then further exposed the employee for contracting the virus, and they contracted it, so therefore from a WorkCover perspective, the employer has not done everything they possibly could?
I don't think it'll matter from a WorkCover perspective, because they're a no-fault system. So if you send somebody in and they get COVID while they're at work or something like that, then they'll just work as any other virus that you can get up. If it went to common law, that would definitely be part of the assessment. Is to say what policies and processes and procedures that you have in place as part of that risk management strategy that we'll talk about a little bit later on, to manage that risk, and how did you address it. And if you haven't got anything in place, like any other injury, if you don't have anything in place for work to get heights, and someone gets on the roof and falls off, you're going to be in a lot more trouble than if you did have everything in place and then someone still obviously fell off the roof or got injured.
Okay, right, food for thought. So in terms of Queensland's public health mandates, we've basically got the 4 public health mandates that are in place for Queensland there on the screen, which you'll notice that there's no construction in there's no hospitality, there's which have been mandated in other states. So that again opens up another area of consideration for employers that are operating across multiple states, because it may be mandatory in one state and not in the other, and how you're going to navigate that. And again, that could be part of that risk assessment that that you should be going through if you haven't already. So in my looking at all of the information that's available, it seems that we've got three pockets of employers, essentially. Pocket number one is these employers that are going to be exposed to this Queensland the public health mandates. If you're in that bucket, you're actually, I reckon, pretty lucky, because it's pretty clear what you have to do. It's black and white, or as black as white as it can be. Then we've got this other bucket that is emerging, and the bucket is getting pretty full. And it is directives that are not from Queensland Health, or they're not public health, but they are directives from entities, which could be a principal contractor, which could be, Qantas has mandated vaccinations, for example. We've got some information that's come out that the likes of QBuild and QPS are issuing mandates for vaccinations. We've got Woolworths and Coles have just come out overnight. Coles is mandating it in certain states, but not in Queensland. Woolworths is mandating it across the country. So we've got all of these directives coming in that if you are a supplier to those companies that have directives, they're then putting the mandate back onto their subcontractors, for want of a better word, which then puts you in a bucket where you don't have a public health mandate, but you've got a directive from a significant contractor that if you didn't do that work, it's probably a big financial liability risk for your business. Then what do you do? So that's bucket number two. Then we've got bucket number three, which is essentially employers that don't have a public health mandate, don't have a principal contractor mandate, for want of a better word, but still want to look at vaccinations. And they're probably,
retail,
general,
a lot of the service industry.
Yeah, general service industry, office environments, etc. They're probably the bucket that's most at risk of putting in a policy that may be deemed to be unreasonable or unlawful. So if we have a look at these buckets of employers, if you're not familiar with how the tier system came about, and this tier system, I'm going to be 100% honest, I don't actually know where it came from. What I do know is that it is published on the Fair Work Ombudsman webpage. And this is how we have essentially been working with our clients to date about determining exactly what the topic of this webinar is. Can we, can't we, or should we?
Yeah, and I think because states like New South Wales and Victoria have been working with COVID, so having people out and about while COVID was active in the community, they've had to develop all these previously. And so I think a lot of these have been sort of moved from those states to others to start using them as a template. Yeah. And then I think, as I said, some things like construction and stuff haven't been mandated in Queensland, but that's not to say that if the situation gets worse in Queensland, they'll start looking at those sort of things as well to follow what other states have done to try and help manage it as much as possible. So living with COVID type thing is going to be just basically going to be community by community, and then seeing if there's a huge influx of numbers, which will put a lot of pressure on hospital systems, then they'll start introducing more mandates, I would see, because that's what they've done in other states.
Yeah. So it's almost, it's like a not if it will happen, it's when it will happen.
I would imagine so.
Yeah, okay. And like I said, we're not going into that social debate about it. It's just a matter of making sure that your business is prepared and has thought about the risks associated with what is best for you. So where there's no public health mandate, what you need to be considering is your contractor directive that we just spoke about. Whether you're a tier 1, 2, 3, or 4 employment category, and they're listed there on the screen. They are available on the Fair Work Ombudsman webpage. Obviously, if you want a copy of these slides after the webinar, you can just shoot us an email. We can send them to you. Also, local authority directives. Now, what I mean by this is particularly Indigenous councils, remote community sectors where the council or the traditional owners or whoever it may be have actually put in an authority directive over their region or area, which has essentially said if you're not vaccinated, you can't come in.
Yeah, and they've got other directives for Cape communities and some of the islands, is that if you've gone past a certain town south, then you're not allowed to come up within a certain period of time. They've got a lot of different directives when you're going into remote communities. And again, we're seeing those in New South Wales and Victoria now, where they're starting to have different actual protocols around communities, not just Indigenous communities, but those rural communities that have very low vaccination rates.
Yeah, and potentially lower access
to medical supplies,
healthcare,
ventilators, and things like that. Because again, not a lot of hospitals have a lot of space for that type of procedure, for that type of care.
Yeah. So, and that's important because those local authority directives are essentially not public health directives. They are at that local level by a local authority of some description, but they may be very specific. Yeah.
Yeah.
And then obviously the risk assessment for your business, which we're going to talk more about. So essentially what we're saying is if you are a tier 1 or 2 employer, and that is essentially, so tier 1 is a workplace where employees are required to interact with people who are at an increased risk of being infected. So these are, it's defined on the Fair Work webpage as hotel quarantine or border control. I think that it could be argued that anybody sort of in the aviation industry sort of falls into that category. If you're looking at hotel quarantine, particularly, you could start to mount arguments in relation to hotels in general or anybody who's exposed to a wider tourism market, particularly when the international borders opened up. Maybe not just yet, but that I think that tier 1 is very much open to interpretation.
It's all going to be, absolutely. Yeah. And at the moment, as I said, with Queensland being such low cases and no international travel as yet, I would say that they would look at it differently to when there is interstate travel, and then the next stage, international travel. It'll all change again as to who's going to be on the firing line and on the front line of the COVID.
Yeah. Okay. And your tier 2 employees are essentially those workplaces who are, as Jamie said before, are working in environments where people are particularly vulnerable to the health impacts of COVID. So your Indigenous communities, elderly, rural, remote, etc. So if a COVID case was to run through the community, the risks associated for them would be far greater. Tier 3 is your general service environments, and essentially tier 4 is minimal face-to-face. So they could be people who are working remotely, that don't have to work in a public office space, etc. So tier 3 and 4, what we're saying is you are at the most, I guess, the biggest risk of, if you mandate vaccination, in those categories, you're at the biggest risk of it being deemed to be unreasonable or unlawful.
And we'll talk about that term in a little bit, what that means and why that's important.
Yeah.
When we go through, start doing the risk assessment side of things.
Yeah. And speaking of risk assessments, over to you, because this is where I tap out. Whenever somebody says risk assessment, I point this way.
Yeah, so in all of these, if you're looking at doing looking at vaccine policies, looking at working with COVID policies, or just looking at your policy in general and saying we're going to be operating with having COVID in the community, all of those things need to be risk assessed in one way, form or another. So using that process, using those tiers to start off with is the initial start of that. And then after that, you start looking at your different activities, your different risk levels, the people you're working with, the staff that you have, and all the other variables that come into it. So either, as I said, develop a policy to keep your workers safe, just in general, while you're working and doing your normal activities, or writing a policy to say that you want all your staff to get vaccinated or not. So that you'd have to do risk assessments for both of those. So if you haven't done any type of risk assessment or policy about COVID as yet, you need to get onto that regardless, because you need to have something in place to tell your workers how to manage and what to do in regards to working with COVID. So whether it's wearing masks, using sanitizers, cleaning, surfaces, making sure they keep, space between themselves and customers if that's possible, and all those things that would come into that. So there has been a case, and I think we'll talk about a little bit later on, about hairdressers, because they're so close, it's very hard to keep that distance, the social distancing. So in their situations, they moved up tiers because they are very, very, they're within very, very close to the people that they're dealing with. It's nearly impossible to put in any measures to stop COVID, like COVID transfer if you've got it. So then they become a tier 1 and automatically are being looking at being mandatory for vaccinations.
Yeah. So, and then, we could debate all day whether hairdressing is any different to go and get my eyebrows waxed or. And
the only reason that's been done is because it's been taken to court.
Yeah.
And so the next time someone will take the next one to court, maybe, and it will go there. But Also, if government sees that and it's happened and it's already happened, then they might say, okay, well, we know that this is a legal test case already. It's already been proven. So then now we're going to apply it to all these other industries.
Yeah. And we do know that there has been a few cases that have been heard, one in aged care, and there's a couple of others that have recently come about where Fair Work have actually upheld terminations. But again, it's not as easy as, I guess, just reading on a piece of paper going, yep, that's great. So would I be right in saying, Jamen, that if I was an employer who worked for, say, Cairns Airport, I was a contractor that had one of maybe food outlets at Cairns Airport, and Cairns Airport has mandated vaccinations, so that then flows on to me. Would my risk assessment, dare I say, be slightly less involved than if I was a office?
Lower tier, absolutely.
Yeah.
So again, what you're trying to do is mitigate any risk. So what you're trying to do with the risk assessment is, one, try to keep everyone safe. That's the main reason of the risk assessment, but then also to help you make a decision about what control measures you need to put in place. If someone's put a decision in for you, so it has said basically no one can work here unless you've got this, then that just takes out all those other equations straight away. Yeah. I would still develop a risk assessment of some description just to go through it, because you still need to manage everything else as well. Mm-hmm. So there's still other risks you need to manage. Just because you have the vaccination doesn't mean you can't catch it or you can't transmit it. So you still need to think about that and still need to have things in place. But if somebody has already said you can't work in this environment unless you've been vaccinated, then that's already been made for you. Then you need to go through the other processes, put that all in place. And then the next level, again, with anything, when you're doing a new policy or a new procedure or a new process in your workplace, is having appropriate consultation. Yeah. Because if you don't communicate that to the workers properly in an appropriate manner, then you can get in trouble for that, even though it's the right decision. Yeah. So then you also need to have to think about that as well. So it's not as easy as just going, someone told me to do it, so I'm doing it, and everyone has to do it. You actually have to go through that process still. Yeah, absolutely. And it's a fine line between how much consultation is proper consultation, particularly where there is an end result that has to be achieved and that directive. But again, you could sit there and say it's process for process sake, potentially, but it's still a process. And yeah, it's just useful to have if anyone is going to, and at the moment it's such a hot topic, if anyone's going to take it to court, it's always useful to have it in place.
And interestingly enough, we're all familiar with the old ambulance chaser type situations, and there has been an increase in employees becoming aware of what their rights are, and there are some legal firms out there which are doing pro forma letters of objection to mandating vaccination. So we're seeing it sort of come from all angles. But I guess if you are really concerned that you haven't got a risk assessment in place for the mandating of vaccinations and you're really not sure where to start, that's where Jamie comes in.
Yeah, and happy to have a chat. Like that's the base level talk and all that sort of stuff is quite easy. So I'm happy to have a conversation. Some things on that, just be very careful. Lots of people, again, without getting into an argument about it, but there's lots of stuff on the internet and all over the place that has lots of information on there. A lot of it is because the internet is so big. Yeah, a lot of it's not in relation to Queensland. Yeah, so there's lots of American, international laws are very different to ours. The way that the things that they're arguing and some of the things that they're saying is not applicable in Australia, let alone Queensland. So just be mindful of that. It is very important that we go to like Queensland sources to get Queensland law on what needs to be put in place.
Yeah. So we've got a bit of a summary about. Oops. Apparently I don't.
We need to move in the house.
Yay! Here we go. So luckily I can do HR. This stuff, so best approach. Try to summarise it as as simply as you possibly can for a subject that's so complicated. Conduct your assessment and consider all of those risk factors and the relevant circumstances, the work performed, and determine if mandatory vaccination is reasonable. Yeah. And that's the key word of the day. Is it reasonable?
Yeah, so we're looking at those tiers again. If you have heaps of close contact, if you're engaging with people from, again, when the borders open for Queensland, when the borders open, we're talking about like when you're engaging with people that are coming up from New South Wales or Victoria or other places where there's high level of COVID, then that's going to increase your tier level and increase your the chances that it would be reasonable for you to determine that we need to have a vaccine. If you're in places where you're not interacting with lots of people, then it becomes less. That's basically as basic as it can get.
Yeah. Okay. Consider the measures that could be applied. So these are the other things that could be applied. So encouraging vaccination rather than making it mandatory, additional PPE that might be available, making sure that you're reinforcing all of those things that are in your COVID safe plan that were there, that we've been working with since this pandemic began. And considering alternating work environments. So can people work from home? Can they do other duties that are going to remove them from that customer facing?
Yeah, that's particularly useful for large office environments. So if you've got 20 people in a room, then maybe you only have 10 and have them shopping out alternate days or something like that. So you're not having everybody in the workplace at once. They can space themselves properly, make sure they clean everything down when they leave and go. And that way you're protecting your staff, but you're also protecting yourself, and every single person's not going to have to go off at the same time. So if one person does get COVID, as we start opening up, there will be people that get it. Then they won't pass it to every single staff member that you have, and you have to shut completely down. When you're working in retail sector and you've got customer facing people, then it might be trying to keep groups of people together, so that if one shift gets it, then you still have other people that you can go to, but then also trying to manage that workplace so that people are kept as far away as possible. You keep the surfaces clean, face masks. I think you would have seen, or probably, I don't know if you have, but you would have seen this morning they were doing lots of new cars from Victoria, where they just opened up today. I don't think I saw a single staff member without a face mask on. All the customers were running around without face masks, but again, trying to manage your staff to try and keep them as healthy as possible, so they don't have to be isolated or told to go home or get sick or whatever. Yeah,
and I think that Cairns potentially is probably a little bit complacent. I know at times I sort of slip into that bucket as well, where we haven't been faced with those big numbers and that widespread community transmission and that business interruption from people being away from the workplace for being sick from COVID, and also the extended lockdowns. So we did the right thing. We had all of our COVID safe plans in place, and the sanitizing, and you were saying before, wiping everything down before you leave. And I think that if there's still people around that are doing that, gold star to you. But I think that potentially we're going to have to pull up our socks, because as soon as those borders do become open, particularly international as well as domestically, the risk of the contracting of COVID is obviously going to skyrocket.
Absolutely. Yeah, so at the moment we've been very, very lucky, extremely lucky. It's been great, but
that hasn't helped us, because it's made us even more a little bit more blasé.
But it definitely is coming. So there's going to be absolutely no doubt that as soon as the borders open, I would imagine Cairns will get a serious influx of people. We might be a little bit cushioned because it will be summer, and that might be a little bit too much. You're not going to tell me that the virus doesn't survive in the heat. No, I'm just saying that Victorians don't survive in the heat. So they may not want to come up and visit us during summer, but we're still going to get a hell of a lot of people coming up this way. And we're already seeing it in Brisbane. We're already seeing that lots of people are coming across the border fairly regularly, and it's all starting to happen already. So, and we're going to see people from FNQ go down into southeast Queensland, even maybe New South Wales, Victoria, and other states for Christmas, maybe contracting and bringing it back. So definitely, it's not a matter of if, but when. Mm-hmm. So dust out your COVID safe policy, because you may not have looked at it for a while, and do a risk assessment on that, as well as doing your risk assessment on your vaccinations at the same time. Okay, so again, important to note that just because you've got mandatory vaccinations in place, if you do, that doesn't mean you stop doing all the other stuff. No. It's not a magic cure, is it? And it's also really important to keep it monitored. So again, as part of my role, is what I do, and I go around with my clients and help them out with that type of stuff. And I've lost count how many ones that we've set up, and then I come back 2 months later and the sanitizer is out and no one's doing all the things that we all talked about and trained about. So again, you need to have the policy in place, but like any other policy or any other process, it's only as good as people that are following it. So you need to make sure you keep on top of that all the time and make sure that we are doing the right thing. It will be harder for customers. If you do have things in place for customers to say they need to do A, B, and C, that will be a difficult process, I would imagine. But again, it's just something you need to keep on top of as best you can. Because it's about keeping your staff safe. Absolutely. So essentially, you can control to a certain extent what your staff do. You can't control what the general population does.
but your obligation is to those staff, not to the general population.
Yeah.
Because I had somebody say to me a little while ago, well, why should we have to get vaccinations for our staff when everybody who comes into the shop doesn't have to be vaccinated? Fair point, like, you know, yeah, fair point. But from a liability perspective, the employer's liability rests with the staff.
Absolutely. So yeah, that's what this is all about. That's what we're talking about, is that how do you manage your risk and how do you manage your staff? I wouldn't even try to manage customers.
All right. So now that we've decided that we're just not gonna have customers.
Yeah, no, yeah.
Easier, right? Yeah.
If I have difficult customers, I just tell them to leave.
But see, if we keep doing that, Jamie, then we won't need to worry about vaccinations because we won't have a business.
No,
so
absolutely.
Yeah. All right,
I'm lucky.
I'm not
I can
going to
do that.
invite you to the customer service webinar.
I can do that. I'm really lucky.
All right, policy or no policy? I think this is a. I'm in two minds about this one. So far away.
Yeah. So again, we've talked about it a few times about whether you have a policy or not to mandate vaccines.
Meditate. That is combining the words now. Good job.
So yeah, so there's a few different things you'd have a look at. The first one is getting that risk assessment done and checking out your tiers and obviously all the other stuff that we talked about, whether there's already one in place. If there is one in place, you need to have one, end of story. If there isn't one in place, so if there isn't a public health order that says that you have to have one in place, then you need to have a look at how risky it's going to be in your workplace to operate with COVID. If it's extremely high risk and you have all those factors in place that says, hey, this is going to be a massive issue for me and for my staff, then it's something that you would need to have a serious look at. If it isn't a massive risk for you and you don't have a really high risk, as in high customer contact and all those type of things, then I'd probably look at not having one because it's just adding more complexities that you don't really need.
Yeah. And I think that because some of the clients that we've been working with have essentially had these directives from subcontractors, not public health directives, sprung on them. Like, I think the Q-Build one came out on the 4th of October and it was effective from the 4th of October.
Yeah.
So it was like, oh, well, we do not have time to get policy. We don't have time to do that right now, but we have to talk to our staff and we have to communicate with them and we want to give them some piece of correspondence about what's happening. So if you're sort of caught in that time sensitive area where your directive's been given and you've got to act right now, the philosophy that we took was saying, okay, well, you're already talking to your employees, so that is a form of consultation. Let's do a piece of correspondence for them, which articulates why and how and what, etc., and then progress forward to getting a policy. So it's it was sort of like a stopgap, but an essential stopgap to give the employees the information that they needed. And then we were starting to ask for things like a confirmation of vaccination status and keeping records, and we'll talk about that. I've changed my mind on that. We'll talk about that at the end. So that's sort of the stopgap. It's not a stopgap, but that's sort of the starting approach that we've been recommending to some of our clients that may not be ready there to do a policy in a full-blown policy.
Yeah, and decisions like that, and it's happening. It's not just them; everybody's been doing it, where they just sort of reacted to something and said, "Right, we're going to make this decision." Really highlights how important consultation is. Yeah. Because if they had told everybody months leading into that they were thinking about it or something in consideration, you could get that in plan, get planned for it. And I would say that a majority of employees will be very similar. There are some people that will definitely won't be getting the vaccine and have very strong views about that. It's a small amount of people. So the majority of your staff, more than likely, if you talk to them and have that process in place, are more than happy to go ahead and get it all done in the way that they need to get it done. If it means that, like, as I said, if you're doing work for Q-Build and they're one of your biggest customers, and that's a huge amount of your income, and you explain it to them and say, like, if that's the work we're doing, this is what they've asked us to do if we want to go on their site. I think it's all fairly straightforward. So most common sense would say, yeah, we need to go get that done. We need to do it. And if we don't, then we know that we're going to have severely reduced hours. We've seen that in aged care already, where there's some staff that said, look, I don't want to do it. I can't do it. I'm immunosuppressed. So I've got a medical condition, which means my immune system is very suppressed, which meant I couldn't take the vaccination for quite some time. I've had it now with other medical things that I need to put in place. But yes, there's going to be people like that. that won't be able to take it for whatever reason. And then so what they've done, they've either changed their jobs, modified their jobs, reduced their hours, or they're doing different things. And so again, most of the time that has been okay.
Yeah. And it's one step at a time. You know, you've got to start with the consultation and start putting out the information about this is where we need to move to, and this is our timeframes, and this is what we need to do. And then discussing those individual circumstances with those employees who may be refusing the vaccination for whatever reason, or may have a medical exception.
Yeah.
So, all right. So if you're going to put in a policy, we can certainly help you do that. But in a nutshell, what does your policy need to contain? It's pretty stock standard in terms of the content. So you've got the safety or the rationale behind the approach that you're taking, the employees that are affected, because you may very well have sections of your workforce that you're mandating and sections that you aren't, because that, you know, half of your workforce might be in tier 1 or 2, the other half may be in tier 3. We could debate all day whether or not that's fair, but essentially that's not what we're here to look at, and that's not what the legislation considers. They're looking at minimising the risk. There will always be the question that, well, if I've got let's say I do refrigeration mechanic, for example, and we service Cape York community. So our trades go out into the community, we're mandating vaccinations for them. But we don't necessarily have to mandate it for our office staff. So we've got 2 sections of the workforce, and we're going to put that in our policy. And then, but what if the office staff get it and then give it to one of the trades and they take it up because they work together?
Yeah. And so, yeah, so liability-wise, you're fine. So everyone knows that is going to happen. So that's not a drama. But you've done like every other thing that we do. Like you get in a car, you put a seatbelt on, you've got airbags, you do the speed limit, most of us all the time. You do all, you follow the road rules, and you still have an accident. So what you're doing as an employer is trying to show that you're minimizing the risk to your staff and minimizing the risk for your customers. If you're, got clients that are saying you need to have these processes in place, or communities in that example that says you need to have these processes in place. So you're doing as much as you can to minimize the risk as much as possible. If it then happens, you can say, I did as much as I can, and you're not legally liable. That's the whole process and what the reason for all of this is for.
Yeah.
So then if somebody then also, from that point of view, is if someone gets COVID and there's an issue and they come back and make sure you've done all the right things. The other one is if someone complains about us being told they need the vaccination, or it's unfair, they don't need the vaccination or whatever, then you can also then, if that's being taken to court, you can also say, these are all the processes that I put in place, the reasons why I put them in place, all the things I considered. And you can see some of the other things in this list that you have here is all the other things that go around that. So like the training and unpaid leave and, time to go get the vaccination and all that sort of stuff, to say I did as much as I possibly could to make it as fair as possible. Everyone knows that this isn't a perfect situation. So like
doing the best
that I can, and then you're more than likely going to be covered and you should be fine.
And that's where it's really important, like we said before, the vaccination doesn't eliminate your risk. So having those social distancing, the cleaning schedules and all that sort of stuff in place for your tier 3 and 4 workers, that's where that's going to become critical. So whilst you may not have a mandatory vaccination for them, you are still fine all of those other what's the word I'm looking for? Protective measures.
Control measures.
Control measures. That's the official term.
Yeah, and again, that's why it hasn't been a massive process from a consultant's point of view. So from our point of view, adjusting all the safety procedures and policies and things like that we do all day, every day, and we have been for 20 years, it's exactly the same.
Yeah.
So even though there's lots of controversy around COVID itself, managing a risk we've been doing that for quite some time, and all the processes are exactly the same, and all the legal framework around it is exactly the same. So there's not a huge amount of difference from our point of view. So, but I know it is still scary.
And I think that it gets complicated because there is such a social debate around the whole vaccination thing, and I think sometimes that clouds the transactional nature of managing a risk.
Yeah. And as I said, as a consultant, I can look at it from that angle, and I don't have to worry about all that, because I've had arguments with people over fit balls and stand up and sit down desks and air conditioned temperature and every else thing you can think of. I've had huge arguments about, and from a safety perspective, it's all very simple.
Clear as mud.
Yeah, not that everyone agrees.
Okay, so It's also contracts of employment. I just want to quickly touch on your contracts of employment, because if you are going through and mandating vaccinations, policies is one thing, that's great, but you also then need to review your contracts of employment, because it's going to come down to where was the reasonable directive given, and was it reasonable? That's where your policy and risk assessment comes in, and then you've got your directive. So if you are going to be mandating your vaccinations, it's really, really important that you have it as a precondition of employment in your contracts of employment straight off the get-go. No good if you're giving your contracts of employment to your employees after they start. You know, it's that age-old thing of the contract of employment is meant to happen before they start, and it outlines all of those preconditions, whether there be medicals involved, whether they have to maintain a driver's license, or they have to, you know, have a blue card, a yellow card, a green card, pink card, whatever it might be. There's so many of them these days. All of those precursors to employment, obviously in that contract, the vaccine is going to be no different.
Absolutely.
So then we get into the fun bit about what happens if they refuse. So if you've given a contract of employment to somebody, and you've got your policy and your risk assessments and everything done, and you're giving your contract of employment, and even potentially in your recruitment phases, if you're telling people that it's a requirement for employment, there may be limited circumstances where an employee can legitimately refuse, and that's going to come down to that medical grounds and the evidence that's supplied. But broadly speaking, once the obligation is expressed in that contract of employment, that's when the directive is given, and that is what then obliges the employee to become vaccinated.
And we've seen that already in every, like, huge amounts of industry already. So there's lots of places where you have to have hepatitis vaccinations. In their contract, you need to have a driver's license. So you need to have, you know, certain conditions of employment.
We have fitness for work statements.
It's a very standard thing. There's nothing sort of controversial about having that at all.
But it will be controversial if you decide that you're just going to reissue all your existing employees with a new contract that says they have to be vaccinated.
That's very different.
Without having the risk assessment, the consultation, the policy, and your communication with your employees about where you're at. So don't use that as a strategy, because that's bound to end you in a court of law of some description, whether it be discrimination, fair work, workplace health and safety. Pick all three.
Reissuing a contract is never a good idea.
No, not without the groundwork. Not without the groundwork. And if you need help to do that, certainly you know where we are. We can help you do that. So again, refusing vaccination. Jamen asked me, $64,000 question, did I just pick that figure? And I'm like, I can't believe you don't know that saying. My dad says it to me all the time. He said, now, Deanne, you want ice cream for dinner? Well, the $64,000 question is your mum going to yell at me because I gave you ice cream for dinner? My dad's probably not watching, unless he's watching on Facebook, if you are my dad. All right, so can they refuse?
So yeah, this is when there is not a contract in place, but we're going through that process. So you've done a risk assessment, you started the consultation process, you're sort of saying, look, because of whatever is happening from the tiers or from your customers or from your assessment, you decided that probably we're going to go down that path, and then people start refusing there. So this is where the murky water is going to start up. If there is a reason, if it's considered a reasonable directive, so again, high risk, lots of customer contact, very hard to introduce any other type of controls in place, as in, you know, very close work to work, or you know, being in an airport or something like that, then it's probably going to be considered reasonable at this time, and you're probably going to be fine. Again, we don't know because not enough has been taken to court. The one that has been, that I'm aware of, was upheld and it was fine. So as long as you've got all the paperwork and all the things in place and it's legitimate. So if you actually are a tier 1 and you've said that you're high risk and you are high risk and all that sort of stuff, it's going to be a reasonable directive and there shouldn't be an issue.
Yeah, and you know, we've spoken a lot about tier 1 and tier 2, and then you've got the 3 and 4. There's nothing preventing tier 3 and 4 employers putting in a policy that encourages vaccination. You may want to give them paid time off to do that. Interestingly enough, I am aware of a work cover claim that has been lodged because an employee received a vaccination at work. Wasn't mandatory. They had got the clinic people to come in, set up a little hub, did the vaccination. She unfortunately has had a very bad reaction and has become quite unwell from the vaccination, and it has been lodged as a work cover claim. hasn't been decided, don't know what it's going to be, but I thought, okay, well, that's interesting because it wasn't mandated, it was voluntary, there was a choice. How's that going to go?
Yeah, and there's been cases previously with travel overseas where people have had to get is it yellow fever or yellow river or something, but all the different ones you have to get yellow something when you have to go to Africa and all those sort of things. We had lots of people go to PNG and all those things and have to get all the malaria injections and stuff and have adverse reactions to those, and they've all been covered.
Yeah.
So I'd be sort of like, again, I can't preempt the decision, but they've all been covered previously. And it's not a legal liability type thing because work cover is a no fault. So you've got it, it's for a work purpose in a way. And so no reason why it shouldn't be.
Okay. But essentially, if they are refusing vaccination, there may be grounds to go forth for the termination, but it's very risky, and you've got to make sure you've got all your ducks in a row, and it's got to be considered on a case-by-case basis. So very important that you reach out and get some support if you find yourself in that situation particularly. So let's talk about medical and health exemptions. So essentially, if where an employee seeks to refuse on medical grounds, you have the right to request evidence. That evidence would be what, in the form of a medical statement, certificate, or
medical certificate initially, and then you probably, depending on that certificate, you might need to get further clarification either through a doctor's letter or a report, or actually go get an assessment, depending on the different levels of what they can be.
Mm-hmm. Okay. So if there is genuine grounds and the medical evidence has been provided that the employee cannot have the vaccination for whatever reason, the employer, it doesn't just stop there. The employer then has an obligation to look at how the unvaccinated worker can be accommodated within the business, and whether any other measures can be taken, whether that be putting in like a periodic testing regime, moving the employee, additional PPE protocols, etc., about how you can keep the employee safe, working from home. There are going to be cases where, let's just say, if I was a contractor for Qantas, for example, Qantas is given the directive, you have to be vaccinated, and I can't get the vaccination for a medical reason, and that's the only work that is there, then we're sort of going to be in that frustration of employment type arena where it's not the employee's fault, it's not the employer's fault, but we just legally can't. Legally is probably not the right way.
And again, there's a lot of industries that are in that position as well. So hospitals have been in that position for a long time.
Yeah.
There's a lot of services that you can't do, like armed forces and things like that, where you have to have certain things in place. It's just, that's been part and parcel of employment for a long time. So again, I don't think that's overly controversial.
I think it's because most employers up here have not been exposed to it. In terms of health and in military and some of those sort of larger scale employers. So for 99% of us, it's all very, very new. And because there is such a social attachment to it, it's almost like, just go and hide in the corner and forget it was even there. But I think as we talk about it, we start to break it down and make it very transactional. And I think that's how we have to approach it, as very transactional. It's got nothing to do whether you support the vaccination or not, whether you believe, don't believe, whatever. It's very transactional business risk assessment.
Absolutely. Yeah.
Okay. Now, my favourite topic, is keeping the record. And I dare say that there is probably a bunch of employers out there which are going to be running for their shredders very, very quickly. And even myself, when we first started looking at keeping the record, we're looking at, obviously, it's a Privacy Act thing, where it is deemed to be sensitive information because it actually has what is called the unique health identifier number on it, which is the most sensitive piece of data other than your tax file number. I didn't know that. So now we do. So first recommendation, if you do not have a need to keep a copy of the record, don't do it. Yeah,
regardless of anything. If you don't have to keep it, don't keep it. It just opens up for issues.
That's it. If you have to keep it, have the employee redact it before sending it to you, and making sure that you actually you've got processes in place, and it should be part of your policy. If you are going to be keeping these records, how they're going to be stored, how you're going to protect the information, essentially, because the health identifier number is actually subject to its own piece of legislation, which I did not know, the Healthcare Identifiers Act. Who knew? So not only have you got the Privacy Act, you've also got the Health Identifier Act as well. So, yeah,
Yeah,
if you
so
don't have to do it, don't do it.
yeah, and be very mindful of having electronics stored, in group folders and all that sort of stuff.
This brings me to my next
Oh,
slide.
sorry, one of the slide.
That's all right. If you have to keep it, you need to make sure that you have got all of the systems in place. And as you can see there by the third dot point, have your employees redact their certificate prior to sending to you, and only send through a secured mean, which means don't send it through info probably go to jail.com, because if that's what happens, that's probably likely where you're going to end up.
Yeah, and I mean, just for your health records, I've had this for like any of the records that I do that are highly sensitive. I always get the physical copy of it and then keep the physical copy in a locked cabinet.
Yeah.
So that I know there's absolutely no way I can hack my locked cabinet.
Yeah. Well, somebody needs to break it. Yeah. There are some platforms that are coming out that are going to be able to help store this information. So the likes of WorkPro, CheckVax, or OpCentral's Vax Central platform, which is essentially it's almost like outsourcing the storage of it, which if you have to keep the record, and again, what we're encouraging you to do is have like a confirmation of vaccination status, like a declaration filled out by your employees, which confirms their record. It says that they've done dose 1 and 2, etc. You can cite the certificate. You can see it. Thank you. You can make a note then of when you cited it. That then becomes your evidence.
Yeah.
And we believe at this point in time that's going to be sufficient, and it's not storing any of that personal identifying information. You're not bringing in all of the elements of challenge for the Privacy Act and the Health Identifiers Act. But I do know that there are a number of employers out there where they've said, just give me a copy of your vaccination certificate, and didn't know. Like it's all happened quite quickly for us, and there is probably copies of medical records and vaccination certificates coming through email, being sent through text message on phone, all of those sorts of things, and we really do need to look at that quite quickly, because it is a huge risk. We all know how information can be hacked and leaked, and it can happen to the best of the best. Credit card numbers, all of those sorts of things. This is no different, except this probably exposes you to a bit of a bigger penalty.
Yeah, and when we're talking about customers as well, we're not storing any of that information. So in a lot of the places where it says you have to wear a mask, or they might say you have to be vaccinated to come in the future, I don't know, but all those type of things that are happening at the moment in other places, asking somebody that and them telling you is not storing the information. It's just getting the information to allow them to enter. So that's not a breach of anyone's privacy.
And citing
information isn't either. And same with all the check-in, all that sort of stuff as well. If it's a requirement of you coming in the premises, them checking in doesn't breach any privacy information or anything like that either. So you don't have to worry about any of those.
Yeah. Okay. So essentially that's the information that we wanted to share with you today. Now, certainly I've got time for some questions, and I fully understand that some of these questions are probably going to be very, very tailored. So if you would like to book some time with either Jamie or myself to have a chat with you about your personal circumstances and your individual requirements for your business, happy to do so. I do know that you can pop your questions in the little Q&A box there on the webinar, and we're happy to go through those. I did have one question.
Just don't send it to info@probablygotojail.com.
Yeah, no, don't send your questions.
I don't know if that's a blue link. Does that mean if I click it?
I don't know. We could try it.
Somebody give it a go and tell us that.
I did have a question that came through this afternoon. Volunteers. Do volunteers have to be vaccinated?
If it's mandated, they're the same as everybody else.
Yeah. So again, with your volunteers, would you do your risk assessment based on tier 1, 2, 3, and 4? So you might have volunteers, for example, say that come in and just do the garden, and they out there by themselves, and they go to the shed, they get the mower out, and they get the back out, and then they go home. They would probably likely be, say, a tier 4, may not be mandatory for them. But if they are doing that volunteer work, which is facing the customers or the visitors, guests, whatever they might be, then you treat them exactly the same in terms of consultation as well.
Absolutely.
Yeah.
The only things that I would do for volunteers in regards to consultation or anything else is understanding they're not in part of your normal network of your consultation and communication. Yeah. So you have to do something different. So you can't just post it and send out an email to everybody because they might not have access to emails all the time, a computer terminal, depending on the style of work they do. They may not be computer literature and all that sort of stuff. So you need to take that into consideration in the way you consult to them. So it's only going to be more things in regards to how to get the information out there, but everything in regards to risk management and all the processes that you have for your staff should be exactly the same for volunteers.
Yeah. So if you've determined it reasonable for your staff, it's reasonable for your volunteers.
Absolutely.
Yeah. And if you've got pockets that are different and you've got half and half, apply the same to volunteers.
Yes.
Cool. All right. Do we have any questions? If you have any questions that you'd like us to answer, jump in and pop them into the Q&A. Otherwise, it looks like we have done such a great job. We don't have any questions at all, which I find that very difficult to believe. We'll give it another minute or so. Any questions at all, jump in and, oh, got a question. If you have 16 people who are vaccinated and 2 who aren't, do the 16 people have any rights?
Not any rights as in such as protection, extra protection against the 2 people that aren't vaccinated. As an employer, you would have some sort of like a way of either discussing that with your staff and making sure that they've got everything in place and all the things that are in place as you would any other staff member. But there's no extra rules or processes that we can put in place that are going to be these, those 2 people that aren't vaccinated have extra things that they need to do as opposed to these 16 people.
Yeah, I guess it's equal rights if you choose to be vaccinated or non-vaccinated, but where you've done the risk assessment and everything else for your business, the 16 people may be able to be continued to be employed if that's the situation. The 2 people may not be, if that's what you're talking about.
Yeah, from an employer's point of view, but from a staff point of view, there's nothing between the staff that should change at all. It's only as Dee was saying that it may be that if you've gone through and done your risk assessment and just say one of your major clients said you have to be vaccinated, then only those 16 people can work for that major client, the other 2 can't, which may mean that they don't get as much work. If you're working in an aged care facility, then it means those 2 people can't work or they have to do something else. If you're working in an area where it hasn't been mandated and it's just it'd be a nice thing to do, but it's not necessary, then you would have all the measures that you would normally have in place anyway and continue working.
Yeah, and I think that it also, when we talk about the employment aspect, it's also, as an employer, you've got to be able to manage within your workplace if there is a cohort in your business that believes they have additional rights because they are vaccinated, and they then potentially start treating unvaccinated staff less favourably, etc. Then we're really getting into that bullying and harassment type area. So training people and giving people education on what is acceptable, what's not acceptable in terms of how we manage vaccinated and unvaccinated may very well become a topic that we have to be talking about.
Yeah, and if that's in the individual workplaces, a ratio like that isn't particularly bad.
Yeah.
So if there's only 2 people that aren't vaccinated, it doesn't mean that they're scarier or they've got more risk or anything like that to your staff, because we're still being exposed to people with COVID all the time. So they've got more risk of picking up COVID, and that's something they have to manage with, whereas the 16 staff that don't. So they are still, the 16 staff that are vaccinated are still dealing with people with COVID potentially, even though these 2 people do. So it makes no difference to them at all. If as a community, we have a huge amount of people that are unvaccinated, the issue then becomes the hospital system. It's not about spreading more risk to staff members. So again, looking at it purely from an employer's point of view, it doesn't really matter from an employer's point of view, because what we're trying to manage is risk to our staff. So there's COVID in the community, we have to just assume that there is and manage our staff in that there's going to be COVID and look after them the best we can. Yeah, so that's all we need to do. The big risk of having heaps of people that are not vaccinated is the possibility that heaps of people would get sick, and then heaps of people need to go to hospital, and then that causes an issue. So it's not really an employment issue.
Yeah. Okay. Ashley, so is storing the document number of a vaccination certificate considered breaching privacy. So you've got two questions here, Ashley. I'm just going to break them down for you. And hi, Ashley. The first part of your question, is it breaching privacy? It's not so much about breaching privacy, but is it subjected to the requirements of the Privacy Act? So if you are storing the document number of the vaccination certificate, the document number, my understanding, is different to the health identifier, but they're both pieces of sensitive information because the document number then links to the identity and the health record. So again, if you don't have a requirement to hold the physical record itself, I would encourage you not to. The second part of your question was, is just the confirmation of the document being cited enough to confirm that the certificate has been issued, essentially? Our understanding is yes, and we've developed a little bit of a pro forma form, which is essentially a confirmation of vaccination certificate. It's a declaration that the employee fills out. They basically say, I confirm that I've had both doses, or I've had one dose and I'm booked for my second dose, or I've had no doses and I do not plan to get vaccinated. And there's a little disclaimer on there that says, you know, I declare that it's true and correct to the best of my records, and I understand that if I'm providing false and misleading information, I may be subject to disciplinary action and or termination. Then on the same page down the bottom, we've got basically the authority of saying who cited it, the date, the time that they've cited it, and their signature. And I think that that is enough.
Yeah, it's not anything new either.
No.
So we've done that with driver's licenses, blue card, yellow card, every other card you can think of, all your vaccination
it's
statements.
Just that we're less sensitive to that terminology as opposed to vaccination records and Privacy Act and all those sorts of things.
So yeah, we would ask. I mean, it's good practice. I think I've done that for some of my clients where we, you know, say we need a driver's license and we need to cite it before you go somewhere. In reality, they could be expired, they could have lost their license and still be carrying it around. We don't actually know that. So it's always just getting them to say, hey, do you have a license? Sign off that you have a license. If something happens to you while you're out and about and we find out eventually that you don't have a license, I've done everything I needed to do to get that license. You're the one that's lied and done the wrong thing, so you're the one that's going to be in trouble. I've done everything I possibly could. Yeah,
absolutely. So if you don't have to keep the records, Ashley, I would be looking at your policy to not do that.
Yeah.
Is there any form of communication we can ask our clients regarding their policy? We want to make sure we comply. Certainly, if you are being directed to follow a policy from a principal contractor or whatever else, ask for a copy of it. You know, policies are essentially documents that are meant to be then read and interpreted by the parties that it applies to. So if the policy applies to you, you are certainly within your rights to be able to ask your clients or contractors essentially for a copy of their policy.
Yeah, and on my long term, so I do a lot of work, as I said, in the Cape and Torres Straits. When we first started this whole process back in the day, I sent off just a basic email to all the heads of department, all the places that I do work at, and asked them, you know, in highlighting recent events, is there anything that I need to do, you know, prior to coming up into community or coming up to do work on your premises, given that we now have this COVID, is there anything you'd like me to do? Yeah. And so then they just sent me back a form that they wanted me to fill out, and again, it was, have you been anywhere past, you know, this past Rockhampton for some of them, or Brisbane or interstate? Have you had any COVID flu or symptoms? Have you had your vaccinations? Have you had whatever? Just needed to fill that and send that back, and they were happy. So it just, again, it just depends on them. So I think they're more than open for that. Everyone knows that everything has changed. So if you've got those long-term clients that you want to be respectful of and just ask them, is there anything changed, anything you'd like us to do? I just send them a quick email to say, is there anything that needs to be done? And so we can get onto it.
Cool. Pam, do you think there will come a time that the government will ask companies for evidence of vaccinated staff members? Well, I don't think that there will, because the record itself, they may ask for a list of staff, potentially. I don't think that, probably not, but if they did, the government has the ways to be able to validate that vaccination by their own systems and own processes. So I don't think so, but being able to then substantiate, if you are required to have vaccinated employees, that you have done the risk assessment and you've got their little declaration filled out, you've done everything you possibly can to ensure that you have got the vaccination in place for your employees, or they've done the right thing and they're disclosing to you that they have actually received that vaccination.
Yeah. So it'd be just about going through that process we talked about before to say, have you been vaccinated? They'll say yes or no. If they say yes, you're pretty much good to go.
Yeah, absolutely. If you want to have a copy of the little pro forma thing that we've got here. Happy to send it out. It's fairly basic, you know, it serves its purpose. But just make sure that you don't send it out in its own right. It has to be done in consultation and in conjunction with all of the other steps that we've spoken about today. Cool. Any other questions? No. So if you do want to call Pam, just shoot me an email after the webinar, so I do remember to send that over to you. And if anybody else would like to reach out for that as well, just send an email through to the office and we can get that through to you. If you'd like us to put you in contact with Jamen about doing risk assessments and reviewing risk assessments, all of those things, let us know. You can find Jamen on Google, or you can find him through us, and we can put you in touch, and we'd be happy to do so.
And again, if it's all that document sort of work, obviously there's fees attached to that. Yep. But if it's just general questions and sort of general info that you need to know, or you're a bit worried about something, I'm more than happy just to have a chat over the phone.
Cool. Thanks, Jamen. You're a star. Look at you go. All right, team. Well, that is us for today. I hope that we have tried to take out some of the, I guess, emotive context around COVID vaccination and bring it back more to a transactional viewpoint, so that we can start to move forward with a bit more confident, hopefully. Yeah,
and we've said it before and previously, but it's not anything scary from a safety point of view.
You say that now.
It's just manage it like anything else you would manage. If you go through that process, 99 times out of 100, everything's going to be fine.
Yeah.
There's not much that can be done if you go through that generalized risk management process and take all the steps. As I said, things are still going to happen. You can have all the safety things in a car, you're still going to have a car accident.
Yeah.
But all those things will hopefully help with an injury, and two, you're not going to be in trouble for it.
That's it.
So as long as you're doing all the right things, it's not going to be a drama.
Yeah. As a mediator, we say trust the process. Trust the process. So we're trusting the process, Jack. All right, guys. Well, thank you so much for spending your Friday afternoon with us. I hope the information was helpful. We will put a video link up. Oh, sorry, one more question. Are we obligated to name those who are not vaccinated? Or that's a no.
No.
I think that comes down to an internal thing. If you've got people that aren't vaccinated and they can no longer be working on certain sites, that becomes an internal.
Yeah, so I wouldn't, if they're working in an environment where it's being mandated by government that they need to, or it's a client that you need to be, have to have it or something like that, then the fact that they're not working on that site, that's all that needs to happen. You don't need to go and tell everybody about that. They just don't need to, they're just not going to show up. Or they were going to be, told they had to be stood down. So it's not something that you communicate to people to say that they weren't vaccinated, so we had to fight. They are, and they've left the employment. That's all you would say. Yeah. If it isn't something that hasn't been mandated, so it's just like an IT firm where you've got no customer contact and you're just working from desk, and someone doesn't want to be vaccinated and there's no reason for them to have to be vaccinated, then definitely don't tell anybody anything anyway. There's no extra risk to anybody else. As I said, as an employer, you should be assuming that your employers are coming into contact with COVID. So you need to manage that as you would anybody else, regardless of whether they're vaccinated or not.
Well said. All right. Well, that's us. Enjoy your Friday. Hope you have a good weekend. And don't forget, reach out if you have any questions. Thanks, Jamen.
No worries. Thank you.
See you next time.
One more year.
One more year. Yeah, same time next time. Thanks, team. Stop video, and we're going to stop the Facebook Live. Thanks, team. See you. I'm not quite sure how to stop it. Finish. There we go. Right.